Good afternoon. Today I'll provide a brief update on the outbreak at West Royalty Elementary School. Today there are 7 additional cases to report, and all are associated with this outbreak. 3 of the cases are under the age of 10 years, and 4 are between the ages of 10 and 19 years. All of these cases initially tested negative and then tested positive on a second or subsequent test. These results demonstrate the importance of repeat testing. 6 of these cases have symptoms of COVID-19 and 1 does not. I am concerned about this outbreak and the impact on children and families. It is worrisome, of course, that so many of the cases initially tested negative and tested positive on repeat testing, but we certainly know that this can happen and has happened throughout the pandemic. We currently have 34 active cases of COVID-19 in P.E.I., the highest number of active cases we've had at any one point since the pandemic began. Our plan is for classes to resume at West Royalty on Monday for students and staff who are not in isolation. However, as an additional layer of protection, and always out of an abundance of caution, we are establishing a pop-up rapid testing clinic for students and partially or unvaccinated staff of West Royalty Elementary School tomorrow, Friday, September 17th, between 1:30 and 5:30 p.m. This pop-up clinic will be held at the West Royalty Elementary School. It is only for children and unvaccinated or partially vaccinated staff of West Royalty School who do not have symptoms. Any student or staff member with symptoms of COVID-19 should go to the Park Street Clinic to be tested. We are asking all children from West Royalty School who are not in self-isolation to be tested tomorrow at this pop-up clinic. Children in grades 4 to 6 should go to the pop-up clinic at the school to be tested between 1:30 and 3:30 p.m. Children in grades K to grade 3 are asked to go to the pop-up clinic at the school to be tested between 3:30 and 5:30 p.m. If there are multiple children in the same family, they can go to the clinic at West Royalty School at the same time. Partially or unvaccinated staff should attend the clinic anytime between 1:30 and 5:30. Students who have been contacted by public health and are currently in self-isolation as part of the outbreak at this school should not go to the pop-up clinic. These students and their families should follow the direction they were given by public health and continue to be tested at the Charlottetown Park Street Clinic. It is important that all students at West Royalty Elementary School be tested at this pop-up clinic tomorrow. Even if you tested negative earlier this week, we want you to be tested again tomorrow. Children who attend West Royalty School should not attend any extracurricular activities until they have received a negative test on Friday. The clinic will use molecular point-of-care rapid tests. Anyone with a presumptive positive result will be called by public health within 2 hours of the test and will be asked to return to the West Royalty School pop-up clinic to receive a confirmatory lab-based test. Children who are tested at the clinic tomorrow will be asked to not go to any public places or gatherings for at least 2 hours following the rapid test. The results of the repeat school-wide testing tomorrow will provide us with more information about potential cases of COVID-19 in the West Royalty Elementary School community. If more cases are identified, public health will investigate by contact tracing and individuals will be advised on isolation and further testing. If there are no cases identified, that of course will be a relief and a positive sign that we are moving in the right direction to get this outbreak under control. A public update on the results of the school-wide testing will be made available Saturday. There are now 19 cases associated with the outbreak at West Royalty Elementary School. We've not been able to link this outbreak or the other school-related cases to travel outside Atlantic Canada. We've announced 31 new cases of COVID-19 in P.E.I. in the past 7 days. 26 of these cases are in children under the age of 19 years. and we currently have approximately 500 close contacts and 300 casual contacts. 87% of the recent cases are not vaccinated. And of course, some of the individuals who have been identified as cases recently are unable to be vaccinated because of age. Throughout the pandemic, we've had examples of individuals testing negative on a first test and then testing positive, as I mentioned. And once again, we are seeing this pattern in the West Royalty School outbreak. The messages are clear. A negative test does not mean you will not be positive on a second or subsequent test. If you are identified as a close contact, it is important for your health and safety and that of others that you follow the rules and remain in isolation. It is important that close contacts and casual contacts follow the public health advice regarding isolation and testing and be tested regularly. Anyone, and of course I mean everyone in P.E.I, residents and visitors with symptoms of COVID-19, even mild ones, should be tested at one of the clinics across the province, and that message is one we've been repeating during the week. Lastly, this strain, which we assume to be the Delta variant, is proving to be highly transmissible, and all island residents, children and adults, vaccinated and unvaccinated, should follow the basic public health measures, paying particular attention to physical distancing from people outside your household or small circle, hand washing, staying home from school, work, and activities when not feeling well, and wearing a mask in closed indoor spaces. I want to thank the students, families, and staff of West Royalty Elementary School, the students and staff of other schools impacted by COVID-19 this week, as well as the staff at the public school branch and the department for their responsiveness, professionalism, and understanding over the past few days. We could not have asked for better cooperation and support as we work together to manage the increase in cases in school-aged children in P.E.I, and in particular the outbreak at West Royalty School. This week has been difficult for many students, families, and staff. And of course, I always want to thank the staff at Health P.E.I Testing Clinic and the Provincial Lab for their ongoing support, and the staff of Public Health Nursing. The work this week to manage this situation and the outbreak are a tremendous team effort. We will get through this together, as we have before and as we will. Let us continue to be patient and kind. Thank you. And so maybe I'll start with those in the room. So Logan, if you want to go first. And
sure. Thank you, Dr. Morrison. Logan McLean for The Guardian. One thing that's been going on in the past week with a lot of testing happening is some lineups, people taking multiple hours sometimes with the site on Park Street. Is there plans for more testing if this continues to be an issue with lots of numbers?
So Logan, absolutely. I mean, we're always trying to manage with the resources we have, but I think we're trying to see if we can do this increased testing during this period of time, and with this outbreak especially. And then we're going to continue, and I know the Health P.E.I is looking at how much longer, how many tests are we expecting to do, and they have always indicated, and they've always responded, as they are going to be tomorrow, in helping get these particular clinics set up right at the school. So I think we'll continue to work together, and I really appreciate everyone's patience in, and especially going through lineups and waiting for a test with children. It's a challenge, and I appreciate everyone's patience, but how important the testing really is.
Right. Speaking of children, I guess we are. The demographics are currently split 0 to, I think it's 10 or 11, but the vaccine cutoff is at 12 years old. Are there any plans to change that to make things a little more clear for people reporting on it in the public?
So it's a good question. We actually have talked about that with our epidemiology team this week, and the reporting nationally is still in those particular age ranges. So So whether we decide to, we need to continue to report nationally on all our cases. So partly it's to align with that national reporting, but whether we need to look at reporting it differently here as well, we actually have been talking about that this week.
Thank you.
Welcome. Hi, Carrie.
Hi, Dr. Morrison. Carrie Campbell, CBC. Thank you very much. I just wonder, first of all, do you know roughly how many students and staff from West Royalty would be in self-isolation, and does it involve entire classrooms from the school?
Yes, so any case, the close contacts are identified as the whole class. So if you're in a grade 3 class and your teacher is a certain teacher, then that whole class would be in isolation.
So do you know how many classes or how many people are in self-isolation from this outbreak?
I mentioned that there are 500 overall close contacts that are in isolation. I don't have it broken down here. I don't have the list in front of me of those associated with West Royalty.
Yeah.
But certainly the majority of the 500 close contacts would be associated with West Royalty, but there's certainly more than just at West Royalty.
So you're saying this is, as far as we know, this is community spread. I just wonder, how well do you think that we have a handle, though, on, where else this might have been spreading, because it's not just from the school, and are there any other measures you think you need to take to try to contain wherever else this might be spreading?
Carrie, I think, and you may have heard me answer a similar type of question yesterday, that, the taking the days without school in place earlier in this week, that it gave us the time to do more testing. So not just at the school, but right across. So looking at whether we could see cases in other schools, also in the community. And we talked about how many tests were done over that period of time. So we certainly have been looking for the extent of any transmission. We have not seen it. These 7 cases are very much associated with West Royalty schools. So, but that's always what we're looking for, and also why that message around if anyone has symptoms anywhere in P.E.I, how important it is to get tested.
Has there been, or is there a possibility there may be any enforcement action as a result of the investigation into this outbreak?
I think what we know, and I think I referenced it, is that it is difficult for families and especially young people to isolate for any period of time. So in terms of we're trying to work with families and students to try to make sure they understand why they need to isolate, how important it is to isolate, and making sure they have those supports. I think at this point in time, it's not been an enforcement type of situation, but as you know, if we ever needed to, we would certainly reach out to our enforcement partners, but that's not been. I think the families, and I have a chance to speak to some of the families when there's a case, and really, it's amazing how much families they want to do. They want to do the right thing. They want to make sure they don't spread COVID any further. So there's a great compliance right across the board.
You mentioned that the pop-up testing clinic is for students and for staff who are not fully vaccinated. Mm-hmm. This issue, I think, is going to keep coming up, whether it's at West Royalty now or at other schools. Families are going to want to know if the adults that are in close contact with their children all day are vaccinated or not. Yeah. Do you think they deserve to know that, or are you going to provide them with that information?
Well, I think that's really for the public schools branch, and I think I've answered that as well before, that but I think we've talked yesterday, the Premier announced a vaccinate or test policy that's going to go into place, and not just for teachers, but for much broader than that as well. But I think that certainly may be part of the ongoing discussion. But I'm wanting to make sure people are vaccinated, absolutely, and if not, we want to make sure they're tested regularly and wear the appropriate PPE to reduce the risk.
Thank you.
You're welcome.
Hi, Dr. Morrison. Thanks for taking our questions today. I know it's difficult news, and I'm wondering, you mentioned the cases today, for instance, some of them have symptoms. Can you go over what kind of symptoms they're experiencing? How are they doing? How are their families doing? And the fact that it sounds like no adults are connected to these West Royalty cases says that they're doing everything right in isolation to this point.
So the 7 cases announced today, Louise, are all certainly the age ranges we gave out earlier. But and I think they have mild symptoms for the most part. Headache, runny nose, congestion, some sore throats. Some have had fever, and of course, when we speak to the parents, they're worried. But they are all the children are at home, and they are not hospitalized. And I think maybe it's a good chance. And thank you, Louise, for reminding me. I think it's a good chance to remind people these symptoms often mimic symptoms of just a cold. So COVID-19 symptoms are new or worsening cough, shortness of breath or difficulty breathing, fever, chills, sore throat, runny nose, sneezing and congestion, headache, a new headache, muscle, joint, and body aches, feeling unwell or unusual tiredness, and acute loss of sense of smell or taste. So and that's probably good to remind everybody.
So pretty miserable feeling, even with mild symptoms.
I mean, I think no one likes to feel unwell, and and what they are describing is could be a very viral kind of influenza-like feeling or a cold. There's a bit of a range, but I just really hope, and I know this feeling is shared by everyone, that all the cases and all our active cases in the province do well.
You mentioned no extracurricular activities for the students at West Royalty. What about recreational sports that are, commingling between the schools? Because as we're gearing up into the hockey season, ringette, still some lingering softball happening. What are your suggestions around that?
Well, we had certainly asked for those to be curtailed earlier in the week for those first few days in all the Charlottetown area, but we've said that they can go ahead, but really focusing on if anyone has any symptoms, they should not go participate in any of those extracurricular activities. And we're asking the students at West Royalty where the cases seem to be, these are where they're being identified, not to participate in those type of activities where they're playing with hockey with students from other schools, for instance, or potentially they not do that until they have their second test results tomorrow.
Okay, thank you very much, Dr. Morrison.
You're welcome, Louise.
Gabrielle Drummond, Radio Canada.
Bonjour, Dr. Morrison. Alors, avant de poser mes questions, est-ce que vous pourriez, s'il vous plaît, juste dire les grandes lignes de ce que vous avez annoncé aujourd'hui par rapport au cas à l'école à West Royalty? OK.
Bonjour, Gabrielle. Alors, il y a 7 nouveaux cas annoncés aujourd'hui. Ils sont tous liés à l'école West Royalty. Il y a 3 cas qui sont en âge moins de 10 ans et 4 cas entre 10 et 19 ans. Et puis, tous ces cas ont eu au moins un test négatif, et puis maintenant, ils sont positifs. Alors, c'est vraiment l'importance de suivre les recommandations d'être testé plus qu'une fois. 6 des cas ont des symptômes. Et puis, on annonce, juste pour avoir une autre mesure vraiment, avant que les enfants retournent à l'école, qu'on fait une clinique pour faire les tests demain à West Royalty à l'école. Et puis, entre les maternelles et troisième année, ils vont aller entre 1h30 à 15h30. Et puis, pour les... Non, je m'excuse. C'est les enfants entre les années 4e à 6e année doit aller faire les tests entre 1h30 et 3h30 l'après-midi, et puis maternelle, les enfants maternels la troisième année, de 3h30 jusqu'à 5h30. Et puis, c'est important qu'on fait tous ces tests pour voir si il y a d'autres enfants qui sont positifs. Et j'espère que non, mais je m'inquiète un peu.
Ok, parfait, merci. Bon, ma première question, c'est que vous avez dit que vous allez continuer avec votre plan pour le retour des classes en personne à West Royalty lundi pour les gens qui ne sont pas en isolement. Alors, pourquoi ne pas continuer avec l'enseignement en ligne parce que les élèves suivent déjà des cours à distance? Pourquoi insister avec votre plan de revenir en personne au lieu juste de garder l'enseignement en ligne pour plus longtemps?
Peut-être quelques points. On sait que la meilleure place est que les enfants sont en classe, en personne. Mais si on a besoin de changer et il y a indication demain avec les résultats qu'on doit continuer parce qu'il y en a beaucoup plus de cas, on peut en faire, mais on va voir les résultats demain. On sait qu'il y a un grand nombre de personnes qui sont les contacts, qui sont déjà en isolement de l'école à West Royalty. Alors, on a tous les classes des cas sont déjà isolées. Alors, mais on veut s'assurer qu'il n'y en a pas d'autres personnes qu'on manque qui sont positives.
Parfait. Ma deuxième question, c'est que demain, la santé publique va revenir avec des mesures plus sévères. On retourne avec le port obligatoire du masque. On va réduire le nombre de personnes dans des rassemblements. Ma question, c'est quelles sont les mesures qui seront mises en place pour les événements, les festivals qui sont organisés par des entreprises, parce qu'on sait qu'il y a quelques festivals qui ont été déjà annulés. Est-ce qu'il va y avoir des mesures plus sévères aussi pour les événements?
On n'annonce pas des mesures, de changement de mesures pour les groupes qui sont organisés. Et puis, mais il faut quand même, la différence c'est ils ont besoin d'un plan d'opération qui sont approuvés vraiment par notre bureau. Alors, on n'annonce pas des changements avec ces groupes, mais on va voir, mais à ce moment, on a discuté et puis on ne va pas changer à ce moment.
Merci beaucoup.
Merci. I will repeat that last question because I think I may have had a question from a similar question, maybe from you, Carrie, about the organized gatherings. We announced there will be changes related to personal gathering numbers coming into effect tomorrow. And the question was, are there changes with the organized gatherings with the bigger numbers? So, and at this point, the organized gatherings are not changing any numbers associated with them. And really, some of the rationale behind that is that any organized gathering has to have an operational plan. And that's why the emphasis yesterday on making sure that the operational plan was in place. With an operational plan, things like physical distancing have to be outlined. Sanitizing, cleaning, contact tracing, all have to be part of part of that operational plan for organized gatherings. Most personal gatherings don't include all those things. I mean, naturally, and so that's why there's a bit of a distinction. And you may have had that question earlier. So, okay. Anyway, thank you very much.